Assisting with instruction in general PE is not always an easy task. This segment will provide you with instructional strategies that can be utilized to help you become more comfortable and confident when helping your students with special needs successfully and appropriately participate in motor games, skills, and activities. The following are critical factors that you as an instructional assistant need to consider before any instructional strategy should be implemented and utilized: activity, safety, level of assistance, and prompting. Factor number 1, activity. It is important for you to know the activities and units objectives in advance in order to choose the instructional strategies that will be most beneficial for your students. Factor number 2, safety. Know the potential hazards and risks associated with all activities and make accommodations and modifications as needed for each student so that he or she can safely participate. It is the responsibility of both the general PE teacher and you as the instructional assistant to ensure the safety of all students in the gym. Factor number 3, levels of assistance and participation. You must consider the amount of assistance that is needed by each student and to what degree each student can safely participate. The amount of assistance required by each student depends on his or her cognitive and motor skills levels. Some students need little assistance in general PE, and some need extensive assistance. As the instructional assistant who works with your students in a variety of settings, you are familiar with the specific needs of your students. Along with the classroom teacher, the PE teacher, and the APE specialist, your input is valued and needed when determining the appropriate amount and type of help that should be given during motor games and activities. There are special considerations that must be taken into account when you are choosing a level of assistance and a level of participation. First, check for restrictions and follow any guidelines and procedures that have been put into place for your students who need special medical consideration and care. Your campus nurse, the student's classroom teacher, and case manager are all people who should be familiar with any medical restrictions, protocols, or plans that have been implemented for students with medical concerns. Second, determine whether or not the student has protective reflexes and can safely block or move out of the way of moving objects. Be prepared to provide a safe area or zone in, around, or near the activity area in order to prevent the possibility of injury to any student. Third, determine the appropriate duration, intensity level, or number of repetitions that will be best suited for your student in each activity or motor task. Make adjustments as needed so that the student can successfully participate according to his or her individual skill level. Last, determine the appropriate type of prompting that each student will require based on his or her ability and needs.